don't know how you do it, but you know what is causing the problem, you know? Oh yeah.
Right in there.
Oh.
Yeah. Oh. Just stretch out the front. Let's go. Nice.
Oh wow.
How are you feeling today? First.
I've been feeling, you know, that my muscles have been less tense.
Good.
The neck thing, you know, is still there.
Tight right in there.
But when I left, I felt better, but then, you know, it gets worse over time.
Like we talked about, right? More temporary fix, but we know if that temporary fix is giving you relief, then eventually treating it consistently, that temporary fix will go longer and longer and become a more permanent relief, right?
Yeah.
Okay. What did you feel leaving? What was that, Friday?
It was Friday, I think. I felt really good. I felt that the bumps have sort of
Gone down.
alleviated. Yeah.
Good.
I don't know that thing.
The metal tool? Yeah.
The metal tool where my back was all red.
Yeah.
That I feel like that did a lot of work.
Oh yeah.
Especially in that part, because I had bumps that I could feel them.
Yep.
They went down.
Oh good.
But yeah, I felt really more flexible, a lot more flexible that day.
Like the neck range of motion?
The neck range of motion and everything. But I did feel a difference in my arm tingling. That is less.
Less. Okay.
That is less.
That's good. That's ideal.
That's permanently less too. It's not like
it didn't come back? No. Sweet. So we hit something right there where there was
it used to go all the way to here. Now I feel like
it's going back up.
It's going back up.
A little centralization going on. That's up. Excellent.
Mostly in the shoulder.
Okay. Start out some active release, right? Loosen everything up. We'll hit it with the metal tools again, and same thing. Adjust you and finish with the ystrap.
Okay.
Sound good?
Okay.
Questions for
A
me?
little bit.
Into the armpit. Yeah. Okay. All right.
Oh yeah. Starts.
Right in there. Start with the scalenes first. Just bring your ear towards my finger and stretch it out. All the way back. Good job. Just like this.
Oh shit.
Feeling it rip
Oh shit.
in the ear? Where are you feeling it?
Where
my fingers?
where your fingers?
A lot of people say they feel it rip all the way up there. Like a
I'm
tear.
feeling that too. I'm feeling the tear, but oh yeah. Like you push here, but I feel.
You feel it in the back?
I feel it in the back.
Okay. So something's making that pain travel. Referred pain, as we call it. So tall. Good. Just let's stretch out the trap a little bit. Good. Arm all the way across. Good. Keep going. All the way. Good job. Not too terrible back here. Back. Right in there.
Oh.
Yeah.
Oh.
The infraspinatus teres minor. That's a good spot. With a little twist at the end. Breathing. Keep breathing. Where are you feeling this one?
Where you're pinching?
Yeah. That's tight. Two more. Last one. Good job. Woo. Just stretch out the front a little bit as well. Make sure all parts of the rotator cuff are moving.
Did you study anatomy?
Did I? Just a bit, yeah.
Just a bit.
Just a bit.
Just a bit.
Just a bit. We did a full body, a human body dissection, cadaver. So
just a bit.
This one's your favorite.
Let's go.
Let's go. One of the most important muscles.
This is the lat, right?
It's a little bit of the lat right there, but then there's a smaller muscle in the same region. It's part of the rotator cuff as well. The subscapularis. It attaches from the front of the shoulder blade and it goes up into this region here. And if it's tight, it really impedes that normal shoulder scapulothoracic range of motion.
Yeah.
And it disrupts how the shoulder moves. And you can lose strength because of it, because it can pinch on the nerves as well. Sometimes you feel this one all the way down to the pinky.
I feel it all the way down to the pinky right now.
There you go.
Oh, fuck.
And we'll check out pec minor underneath here.
Yeah, that one is
A little more tender right there, huh? Oop. There we go. More good things.
Yeah. Last time I just wasn't having it though. I wasn't even expecting the pain, you know?
Yeah.
Ooh.
This time you are?
That's the only difference, by the way.
Yeah. Well, these knots you were saying up here are feeling a lot better.
Yeah. I feel a lot better
Good.
from when I first came in.
Yeah, you got some work to do with you, that's for sure. But that's all right. Remember, you didn't even know that the low back was tight all the way down here?
I didn't even know. I thought all of my tightness was in the
Up here.
back, yeah, up in the traps.
Yep.
I didn't even know I had armpit muscles.
Now you do.
But I think that that first time had like a permanent effect on, you know, the knots in the back.
Yep. Well, if there's a physical change in the muscle, theoretically, I'm going to want to do a physical type therapy, right? Something that will combat that. Something a little bit more forceful, a little bit more deep. Pressure okay?
Yeah, that's fine.
It actually feels way different than just that first treatment, doesn't it?
Yeah, way different.
The knots are so much smaller. The blood vessels aren't even popping up here. They're just excellent. Getting everything
Yeah,
changed.
these didn't come back. Like the tension didn't just come back. No,
Like it normally would.
yeah, I feel like this was more of a permanent thing.
Right.
I think maybe you two can see it.
See what?
Like the change, or how it's like. I don't know. you seem to know.
Yeah, I can see it. Like, maybe not see it, but I can feel it, right? That's why we're using metal tools versus some of the older wooden or clay tools. That's how this therapy kind of originated. So now we are definitely working through the lat a bit because we have to get through it to get to those smaller muscles underneath, right?
Oh, wow.
All right, good. How's that feel?
That was rough.
Yeah. Move the shoulder around now.
Oh yeah.
Much looser?
Oh yeah.
Good.
Oh wow. Oh, this feels different. This feels really different. Wow. You know when I used to raise my hands like that, I used to see like the level is different.
When in the mirror, when you're doing something?
Not necessarily looking in the mirror.
Just looking at your hands.
Just looking at my hand.
Now they're,
you know.
now they're much cleaner movement too. Like the shoulder just wants to go straight up.
Wow. Oh, this feels amazing.
So just slightly higher on the right. So we got a little bit to do, but after the treatment today, those are going to come down and be level. Cool. Face down. Yeah, start away. Feel that one?
Yeah.
Yeah.
Wow.
This one, you'll feel a little more, okay? Good. All right, lay on your left side, please. Slide the hips towards me. Good job. Letting that relax. Good. Woo. Yeah. Other side. Let that hang out. Good. Ooh. Wow. On your back. Good.
I've never seen that one.
You just laugh. Let that relax. Good. One more. Nice. We're doing it because the hips, the ball and socket joint, the SI joint, the low back, they all work together, right? So just treating that one area, not going to be what we want to do, right? We want to treat the whole area so it can work together. Right?
Makes sense.
Right. Snug that up. Good. Tuck the chin down with me, sit up, and relax back. Don't mind me. A little stiffer here. Oof. Beautiful.
That was good.
That's good. So you're just relaxing. Same thing as last time. Big breath in and out. Good job.
Oh wow. So this time I felt it like all the way here.
All the way where?
All the way maybe
Into the upper back?
Yeah, into the upper back.
More than last time?
Way more than last time.
Way more than last time. Good. So your joints are moving easier,
Yeah.
right? Which means the adjustments go further.
Wow. The neck cracked like crazy. I like
On
it.
that right side?
On both sides. On both sides.
Good.
Yeah. But it feels like feels really nice.
This is how you're supposed to.
Feels really, really nice in the neck.
Good.
Yeah.
Come on up. So stand up. Stand in front of the mirror again. Oh yeah. Look at that posture now. Shoulders are level. Hips. Let's check these out. You're more upright too. Oh, boom. Dead on with the hips. Perfect.
Yeah, this feels amazing. The neck feels like I have a new neck now.
New neck. Not new, just refurbished. Just refurbished.
Refurbished.
Yeah.
Thank you, Doc. This is good.
So you're feeling good right now.
Yeah.
What's the difference? You've had treatment in the past, right? What's the difference that you're feeling for patients that are kind of stuck in what you were experiencing versus this, so they can get help?
Oh man, I've tried 4 different chiropractors.
Yeah.
And I paid a lot of money. And I'm a student, so this was really rough for me. And I feel like everybody is sort of the same, you know, in their treatment. They have like a set of, at least the first 2 I went to, they had the exact same set of moves.
Different chiropractors?
You know, neck, back, and then one guy had this ear thing.
Yeah.
That was like
I know how to do the ear. I did the ear thing.
You did the ear thing, right? Yeah, we did the ear thing.
Yeah, but that was because your ear was giving you trouble from that muscle going all the way up there.
But that didn't fix the problems,
No.
man, you know? These weren't addressing the problems, you know? They were just a typical set of moves. I feel the difference is that you're using, you're bringing like different dimensions to this. You're using different techniques and things that, like, you know what.
Hard to
You know,
explain.
it's not hard to explain. It's actually pretty simple. I don't know how you do it, but you know what is causing the problem, you know?
It's just, like you said, I know a little bit of anatomy, right? So
That is
if you
correct.
know the anatomy, you can interpret that how what's wrong, and then once you know what's wrong, then you know what to do to fix it, right?
I think maybe they just didn't know what the problem was, so they were just doing adjustments on the
And
the
a lot of times they weren't taught some of the things I was taught, right? So that's what they know, right? Like a carpenter knows how to hammer, so they're gonna hammer, right? If they don't know how to do something different, they're not gonna do anything different. And it works for the majority of their patients, and that's great because then they get better. But you were searching for something that worked for you.
Yeah.
Hopefully, we found it, right?
My situation is particular and it's peculiar, and you know,
It's different.
it's very different from everybody else. And I know a lot of people who also have peculiar problems.
Yeah.
So
because that exam took a while for you because we were trying to figure out what was going on. You had a few different things.
a few different
And then
things.
we also found multiple different things as we were treating too. We found that low back tightness. We
Yeah.
found the armpit, and
And
then
you even told me about that thing. So you don't know.
Osgood Slaves. Yeah.
Yeah.
Then
If you have like a bone bump, it's nothing.
well, it's not nothing, but it's something. But it's something easily fixable. So
Come here. Tower Chiropractic.
all right, man.
Downtown.
Anything else?
No.
You're doing awesome. You're gonna improve even
Thank you
better,
so
better. We're gonna change the treatment because we're not gonna need to go so deep anymore. Once we get that change, then the body wants to change because we're getting it in that healthier position. It's going to want to stay there, but we also have to keep it there, and you have to do some things too. Also, I'll give you some exercises and whatnot once we get you to that point.
Okay.
Sound good?
Sounds great.
Sweet, man.
Alright. That's nice.
No shaking hands.
I guess.